Disclaimer: the contents of Studio 151 podcast and the TU Communication Disorders Connection podcast do not represent the views and beliefs of the University of Tulsa and the Mary Kay Chapman Center.
Hello, welcome back to another episode of the TU Communication Disorders Connection podcast. This is your host, Alyssa Hall, and today I'm joined by two special guests to introduce the topic of voice. Our first guest today is Brooke Stemple, who is a first-year graduate student at the University of Tulsa and also one of my classmates. Brooke, thank you so much for joining me.
Thank you for having me.
And our second guest is Dr. Marianna Rubino, who is a voice-specialized SLP researcher and soon-to-be assistant professor at the University of Tulsa, one of our new faculty members in this incoming year. Dr. Rubino, we're so excited to be chatting with you today.
I'm thrilled to be here. Yeah. This is my first official thing as a TU person, I think. So
we're super excited for you to be here.
Mm-hmm. Brooke, I'm going to let you take over and get us started with some questions for Dr. Rubino.
Yeah, for sure. So you had the opportunity to come and guest lecture at TU this semester, and that was a really exciting opportunity for us to get to know you. But I would love for the podcast if you could tell us a little bit more about your background. What did you originally study in school? Did you have a conventional or non-conventional path to speech-language pathology? Just any of that kind of stuff.
Yeah, so I would say I had a pretty unconventional path to speech pathology. But it's funny. I feel like a lot of voice people have kind of an unconventional path. So maybe I'm conventional in the voice area. I don't know. But yeah, so for a while, for about 10 years, I was a professional actress in Chicago and New York and Houston. And then I kind of just got a little burned out from the survival jobs. Yeah. So one day I was just Googling at one of my survival jobs, and I found this career, speech language pathology. And I thought, what is that? Because like many people, I had no clue what an SLP was, what they did. So, of course, I spent a little more time looking that up, and I found that one of the things that they do is help people with their voices. And then I remembered in my actor training during my MFA, I did some voice training, and I remember having some questions about that training and kind of not really totally understanding what the goals were, how I could help myself and help others. So I thought, okay, well then why don't I go and do this school? And I'm so thrilled that I did, because it's kind of like, this is the perfect career for me. I love the combination of the science and the human element. And then, you get some artistic element there too, because I think working with people is an art form. It's kind of funny to think about writing a session plan as a creative activity, but it actually is, because you get to think like, okay, so I have this stuff that I learned in class. I know this stuff that we have in our supply closet. I know this particular patient. How are we going to put this all together to create something that's going to be successful? So yeah, I really love this profession, and I love researching too. So I work with clients less frequently now. Yeah, because during my doc program, I was working per diem at a hospital in an acute setting, which I really enjoyed. But in my postdoc, just because I had kind of reestablished myself, I was in Delaware for my doctoral degree. So now I'm in Houston and, licensing, getting to know people, yada, yada. I've been working with some of my actor friends who are in the MFA acting program here, because a couple of them have come up against some really big voice challenges during their program. And when they're in shows, there's no time if you're in a show to go and rest your voice. So it was kind of almost like a triage moment where I had to come in and say, like, here's what you got to do. Call the doctor. I talked to a very sassy primary care doctor who was telling this young woman, that kind of sassy in a bad way. He was telling this young woman she was in a show, and he's like, well, that show's not going to happen. He wasn't even going to give her steroids. So steroids are kind of the typical stopgap having an emergency situation. He wasn't even going to give her steroids. So we had to get her hooked up with, a laryngologist who could understand these issues from a realistic point of view.
I want to jump in for a second.
Yeah.
I'm curious, when you were an actress, did you ever work with speech pathologists in any capacity or have any kind of like vocal hygiene training?
No, no, I had no clue. I didn't know speech pathologists existed.
Mm-hmm.
All I knew, I had my voice teacher. So in my first year, I was in a show. Ugh, this is this comedy of errors because I had this stage door. So when you're rehearsing, you have these kind of stage props that you use that aren't really the real props. It's just so you can practice. So there was a door, it's called a stage door. It's kind of like a free floating door that you can move around. So we had this stage door. It wasn't properly weighted. So I pushed on it and it came down like this and landed on my Achilles tendon. So we were performing, we were in the middle of this show. We'd 1 week of shows. I had my tendon crushed. So I had to be in one of those walking boots. So we had to restage the show. And of course, this in the stress of it, my voice went out.
Of course.
So I've got this walking cast, a bad voice, but I had no clue where to go for the voice issue. So I went to my voice teacher and, his advice was to, drink pineapple juice, which I think, yeah, I'd have to do some research, but I think there's some very small benefit to that, and to do, hot showers, which is great. The hydration is helpful, but I had no clue even about a laryngologist to go to a laryngologist and say, so listen, can you help me?
So today, now that you do have some clients that are actors and actresses, what
Mhm.
are the main things you tell them about vocal hygiene? Maybe also including some things about stress too, not just overuse, because some of our listeners may not be an actor and actress, but they may have some stress-induced voice deficits.
Absolutely. Yeah. There's kind of controversy around this term. It's called laryngoresponders. So some individuals are thought to be, when they have stress, they're the ones who are more likely to lose their voices or to kind of have that stress show up in their voices. If laryngoresponders exist, I would classify myself as a laryngoresponder. So what I tell my actor friends, hydration, 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 because these folks, they are busy all day long. They're breaking a sweat multiple times a day. They're using their voice all day long. I really stress hydration for them. And I've gotten, you know, the folks that have come to me for help, I've gotten them on steamers, so those personal steamers. And I tell them too, back to the stress thing, because I mean, their programs are stressful. Masters in speech is stressful. And it's just, I tell them self care. If you can, go to therapy, go to stuff that's going to help you understand your responses to stress and help you to manage your stress as well. And just, of course, everyone says meditation. Anytime somebody tells me to meditate, I'm like, I don't want to, it's boring. But, for some people, it can be really helpful. That or just, take your little, mental health walks, hot girl walks, I guess they're called sometimes. To kind of, well, Alyssa, you were saying this, take a walk outside. It just feels nice to be outside. So,
Uh-huh.
yeah, sometimes those kind of self care things can help with the stress levels as well.
Yeah, I think it's kind of funny because we do like talk about vocal hygiene a lot as speech pathologists. Yeah,
Hmm.
I feel like sometimes I have the worst vocal hygiene. I think I'm the worst about it, but I need to be better myself.
No, I think sometimes we are our own worst patients in a way.
Yeah.
Because another thing that I look at is adherence. It's a huge question. So we know drink water, we know all this stuff, but
Mhm.
why don't we do it? And I try to think about it not as in a finger wagging way, like, why aren't you doing this? But to really ask yourself, okay, why am I not doing this? And I think a question for me is, why don't I like meditation? And I think partially it's because I don't like that kind of turning off my brain
Mhm.
type
Mhm.
thing. I think it's a little scary, actually.
Yeah.
Yeah.
Like to release control of the brain too. It's very vulnerable. And I think working with voice is also pretty vulnerable. working with any of our patients, I think there's some vulnerability there. And I think, as clinicians too, we have to allow ourselves to kind of enter their state of mind and try to have empathy with them. So that requires, vulnerability on our part too. So, but it's hard. I mean, especially with the world the way it is. I mean, who wants to be vulnerable these days, honestly?
Even listening to your own voice back, like on this podcast, or if we have clients where we record speech and listen back for disfluencies or pitch breaks or whatever we're listening for, even listening to our own voices in the background past our clients' voices, it just feels strange. And so I agree. I think putting ourselves in that position and also forcing ourselves to do that, like if we're going to do something like that for our client, we also need to model that as well.
Yeah. Well, funny story, maybe to me, but so yesterday, my mentor here during my postdoc, he scoped me for her lab because we have a couple of undergrads in the lab and they've never seen a scope. She scoped me, and I have a little tiny baby polyp on one of my vocal folds. And in that moment, I was like, bad, 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 bad voice person. You have a polyp. And then I kind of traced back to when I think I got it. And it kind of, I just reminded myself, okay, maybe we need to take our own advice. We need to do our water. I warmed up before this, thank goodness. And I'm just trying to remind myself to stay in my resonant voice. So, I mean, when I listen to my voice back, I know I've had a couple of pitch breaks.
You've been talking about like the impact of stress and the impact of the emotional vulnerability that comes with voice. We've talked a lot recently about the intersection of therapy and counseling, especially when it comes to like fluency. Does counseling factor into your treatment often? Not just counseling and strategies, but the emotional counseling aspect?
Yeah, big time. I mean, you talk about these actresses who have these voice problems and they're in the middle of a show. I mean, that's a huge amount of stress. This one woman I was working with, she was the lead in the show and she was losing her voice. So she's the lead. And this is the one where the sassy doctor said, well, that show's not going on. No, it doesn't work that way, friend. Yeah, people have so much pressure on them too. And when you talk about teachers who frequently get voice disorders, it's kind of, do I have the voice to work this job that I've trained for and been working on for, however many years? Or do I need to quit my job and do something that's maybe not as taxing on the voice?
Yeah.
So, I mean, there's huge stress on these folks. And I think a lot of times for people who don't kind of understand voice disorders, they could be a little dismissive of voice, like, oh, it's just your voice. What's the big deal? But, for a lot of people, major stress arises from these voice disorders.
Going back kind of to your research in a way, I would be interested to hear like identity with our voice, especially for those people who their voice isn't going to sound the same. Just in general with other voice disorders, can you touch on that just a little bit?
Yeah, it's massive. So I remember during my voice disorders course when I was in my master's program, young guy came in, early 20s guy who was a singer performer, and he developed spasmodic dysphonia early, right? And he had been very active on stage, singing, acting, and he developed spasmodic dysphonia. And like you said, Brooke, you can't cure it. You can treat the symptoms. For him, you could tell it was a very devastating diagnosis. So what's the other job that we're gonna do now? Yeah, I mean, I think identity is massive in voice disorders. Well, another aspect of identity is kind of how do I fit into the world too?
I think we do a lot of confidence building in our everyday practice, more so than I would have thought coming into speech pathology. But I think that's such a special part about our job and how we get to see those clients week after week and help build their confidence in themselves and you, establishing that rapport. And we get to watch them grow in that and then release them at the end. And I think that's super sweet. And one of the reasons I chose speech pathology.
Yeah, Absolutely. I remember during my CF, I was working with a man on his dysphagia, and we were working on hard swallows. And he did a hard swallow, and I was like, yes, way to go. And he's like, kind of looked at me like, why are you getting so excited about swallowing? But I was just so excited, like, you did it. Great. Good job. So yeah, I think it's wonderful that, we can share people's advances when they can increase their skill, and that of course can support their quality of life. I think that's a wonderful thing that we can share with our patients.
I'm curious, you have mentioned helping like your friends with their vocal hygiene and especially your performer friends. Do you think people trust your insight into these things more as a former performer yourself?
Yeah, 100%. So a big thing in every domain obviously is rapport. So one of the things that is a strength for me when I'm working with a performer for establishing rapport is that I've been there. I've been
Mhm.
there and I know what the demands are of the job. But yeah, I think it definitely helps people to know that I've been there. And then also, I mean, I've never had a diagnosed voice disorder, but I think I definitely have a tendency towards effortful vocal pattern. Why be embarrassed? It can help others. So
All right, with that, we are going to wrap up our discussion about voice. I want to thank both of our guests. Brooke, thank you for being here today.
Thank you so much again.
And Dr. Rubino, thank you so much for chatting with us on the podcast.
thanks, Alyssa. Thanks, Brooke.
And to all of you who listened along, we hope we will catch you on the next episode. Goodbye.
For further information or podcast ideas that you'd like to share with us, please reach out at 918 631 2504. We would be happy to chat with you. Remember, communication is not just about words, it's about understanding, empathy, and connection. Until next time, keep listening, keep learning, and keep communicating.